I'm Trudy Gores, and today we're going to talk about hernias of the abdominal wall. The first kind of hernia that we'll talk about is the most common type of hernia, and that's an inguinal hernia or a groin hernia. A hernia in general is a hole in the abdominal wall where something is abnormally pushing out. In the groin, this is usually fat. It can be intestine if it becomes larger, and these are the more dangerous kind of hernias. We want to avoid strangulation, and so if you have a lump or some pain in your groin that needs to be evaluated, please let your doctor evaluate you, and then hopefully we can talk about the surgical options for this. In people who have groin hernias, when they present, usually this is again something that has been forming over a period of time. The hole in your abdominal wall can be fixed in two different ways. The traditional way of fixing an inguinal hernia is to make an incision over the groin and to actually close the muscle and support this with a piece of mesh. More advanced procedures are at least available to get people through the surgery with less pain and back to work quicker, and this is a laparoscopic approach. A laparoscopic inguinal hernia repair, instead of having any incisions in the groin, involves an incision at the belly button, about 1.5 centimeters in size, and two 5-millimeter incisions on either side of the abdomen. The way that the hernias look from inside the abdomen can be seen on this piece of paper. You can see the blood vessels going down into the legs. You can see these holes in the abdominal wall. This is from the inside. So you can imagine as someone is standing up that the abdominal contents can actually fall into that hole, and that's what you're actually feeling bulging through the abdominal wall. In the operating room, after we make our incisions, we're filling your belly up with air, so therefore this is a procedure that's done under general anesthesia. The procedure will take about 20 to 30 minutes depending on other surgeries that you've had and any scar tissue that's involved. Once we're in the abdomen, we're able to work within the layers of your abdominal wall in order to get down to the hernia itself. Once we actually have uncovered the hernia, we will cover this entire area with mesh, as can be seen on this picture here. Once we're able to develop the plane between the layers of the abdominal wall, we're able to place some mesh over the hernia and then bring this tissue layer over the top of the mesh so that we actually can protect the colon or the intestine from having any contact or having any erosion with the mesh. After this is completed, we're able to close all the small incisions on your belly and put some degradable stitches in those, and then place some super glue over the top of the incisions so you don't have to worry about any band-aids or bandages. After surgery, in contrast to the traditional repair, I usually only restrict your activity for 1 week. Again, restriction of activity is anything greater than 10 pounds or anything where you have to strain your belly to lift this. After that, we want you to get back to normal activity. Immediately after surgery, it's safe to walk, it's safe to go upstairs, and it's safe to return to work when you feel like you can do the work that you need to do. People usually take narcotics for 1 or 2 days after surgery and then transition to Tylenol or ibuprofen type medications after that. The recurrence rate, or the failure rate, of having a laparoscopic inguinal hernia repair is equal to that of an open or traditional repair, somewhere around 2%. And this is due for various reasons. The mesh can tear, the mesh can slide, people can put on significant amounts of weight or have significant blows to the abdomen in the future. However, these are very rare occasions, and usually this is a durable repair that will basically last you the rest of your life. Another type of hernia that can occur on the abdominal wall is an umbilical hernia. Obviously, an umbilical hernia occurs around the umbilicus or the belly button. This is something that all of us are technically born with, but can actually obliterate or close while we're young. With weight gain, pregnancy, just general activity in life, we can have umbilical hernias reopen. And so this hole of our abdominal wall will then allow usually fat first and then possibly intestine to come through, and you can feel a bulge at your umbilicus or your belly button. Having that bulge there can be painless or can be associated with pain. If you are having any of these symptoms, we do want to examine you and evaluate you. If you're found to have a true umbilical hernia, the possibilities for repair include an open type procedure with an incision around your umbilicus or a laparoscopic type procedure. An open procedure involves a small incision right around your umbilicus or your belly button to get down to the muscle itself. Once we get down to the muscle and the hole, we're able to close that usually with the help of a piece of mesh. The mesh is actually placed beneath the rectus muscles or the six-pack muscles of the abdomen, and then we close the muscle over the top so that we can actually reimplant or make you a new innie belly button, so that cosmetically this is quite favorable. After approximately 4 weeks or a month of being careful with very heavy lifting, you're usually able to get back to exercise, work, and all the other activities that you require your core muscles for. The recurrence rate for something like this, that is a small belly button hernia with a small incision, is approximately 5%. And that's again because we use our cores for a lot of different activities. And again, weight gain or potential pregnancy after repair can put undue pressure on the repair and cause you to have a higher chance of recurrence. Smoking and diabetes can affect the way that you actually heal. So we usually will talk to you about trying to lose some weight potentially or quit smoking for approximately a month before these types of surgeries. People who have a laparoscopic repair, these are different types of surgeries involving no incisions around the umbilicus or the belly button itself, but keeping all of your incisions out laterally. The benefits of actually having a laparoscopic repair versus an open repair is that you have smaller incisions further away from your belly button. The downside of having a laparoscopic repair versus an open repair is that you have mesh that's actually in contact with your intestine because it's placed inside the abdominal cavity. And we do not actually close the hole or the defect when we're doing a laparoscopic repair. Simply, we're taking the hole where we have the herniated contents and bringing the intestine or the fat back into the abdomen and then placing that mesh underneath the hole to keep any contents from the abdomen from getting back into the hernia. Some people will still feel a bulge at their hernia site, but most importantly, there's no intestine or fat being strangulated within that since it's blocked by the mesh. The recovery from this is very similar to an open repair. We usually want you to be careful with your heavy lifting for approximately 1 month. I'll see you post-operatively in the office for an exam at about 1 month. And again, you can go back to work and normal activities short of heavy lifting when you feel like you're able to do so.